How does stool consistency impact rectal bleeding symptoms? Imagine sitting on the toilet and noticing blood on the tissue or in the bowl. Sometimes, the cause is linked to how your stool looks and feels. Stool consistency plays a big role in whether you experience rectal bleeding and how severe it might be. When stools are hard and dry, they can make bowel movements difficult and requiring straining. This straining can cause tiny tears in the delicate lining of the anus called anal fissures. These tears often bleed and can cause bright red blood on the stool surface or on toilet paper. Hard stools can also push on swollen veins in the rectum called hemorrhoids, making them worse and more likely to bleed. On the other hand, very loose or watery stools, which happen with diarrhea, can also irritate the rectal area. This irritation can lead to inflammation and sometimes bleeding, but it is less common than bleeding caused by hard stools. Normal stool is usually medium brown, smooth, and formed but not hard or overly soft. When stools are too hard, they increase the chance of mechanical trauma during passing, which explains why bleeding is more likely with constipation. If you notice bright red blood after a bowel movement, it often indicates bleeding from the lower part of the digestive system, near the anus or rectum. Changes in stool consistency can also be a sign of more serious conditions like colon or rectal cancer. For example, narrow or ribbon-like stools may signal a growth blocking part of the colon. Persistent changes in stool shape or consistency, along with rectal bleeding, should always prompt a visit to a healthcare professional. They can help determine if there is an underlying issue that needs treatment. Managing stool consistency is important for colon health. Drinking plenty of water, eating high-fiber foods, and avoiding constipation can help make bowel movements easier and reduce the risk of bleeding. Remember, any rectal bleeding that lasts longer than a few days or is accompanied by other symptoms like weight loss or abdominal pain should be checked by a doctor. They can perform tests to find out if there is a serious cause, such as colorectal cancer, and recommend appropriate treatment. Taking care of your bowel habits and seeking medical advice when needed can help keep your colon healthy and prevent complications.